What is scapular dyskinesis? Have you ever wondered why some athletes struggle with shoulder movements? One common issue they face is scapular dyskinesis. This term refers to an abnormality in how the scapula, or shoulder blade, moves during shoulder activities. Instead of gliding smoothly, the scapula may not move correctly in relation to the arm and shoulder joint. Scapular dyskinesis is not a specific injury but rather a dysfunction that often arises from shoulder injuries or muscle imbalances. The scapula serves as a stable base for muscles that control our movement. When it does not move properly, it can impact shoulder mechanics and increase the risk of pain or injury, especially for those involved in overhead sports. Key muscles involved in scapular stabilization include the serratus anterior and trapezius muscles. These muscles work together to ensure the scapula is positioned correctly during our movements. If these muscles are weak or not functioning properly, scapular dyskinesis can occur. For professionals in fitness and wellness careers, understanding scapular dyskinesis is essential. It is frequently seen in athletes with shoulder injuries and can lead to functional deficits. To assess this condition, a physical examination is typically performed to identify any abnormal scapular motion patterns. Rehabilitation for scapular dyskinesis focuses on restoring proper muscle activation and balance. Specific exercises can help strengthen the muscles that stabilize the scapula. For instance, performing push-ups on a stable surface can enhance the strength of the serratus anterior, while push-ups on an unstable surface may increase trapezius activation. Shrug exercises can also be beneficial. They activate the trapezius muscles and promote upward scapular rotation, which is helpful for those experiencing downward scapular rotation syndrome. However, these should be introduced carefully during the later stages of rehabilitation to avoid disrupting muscle balance. In careers related to sports, fitness, and wellness, professionals often utilize kinetic chain-based approaches. These methods consider the entire upper body and core to effectively address scapular dyskinesis. This comprehensive strategy aids athletes in regaining normal scapular motion, reducing injury risk, and improving performance in dynamic movements. In summary, scapular dyskinesis is a condition characterized by altered scapular motion, often linked to shoulder dysfunction. It requires careful assessment and targeted rehabilitation focused on stabilizing muscles to restore normal shoulder mechanics. This knowledge is vital for anyone working in sports rehabilitation and injury prevention.